What are the symptoms of STDs in men and what are the symptoms of STDs in women? I'm going to give you some of the more common symptoms that we see. I'm Dr. Jen Caudle, a practicing family physician. Let's just jump right in, okay? So some of the more common symptoms that I see are genital bumps or genital sores, okay? When I say genital, I mean bumps or sores around the penis, around the anus, around the vagina. And you might be saying, well, what do they look like? Well, I'm going to give you some other symptoms to distinguish these from others, but bumps and sores really is exactly how it seems. Some sort of lesion down there, okay, I say down there as a way to just describe that's where people are seeing it in their genital area. Now, I have a video on the importance of, if you have something going on down in your private area, I want you to take a look. I want you to get a mirror and actually take a look to see what's going on, because a lot of times I'll see patients who feel something or think they feel something. They don't look because they're afraid, and it turns out just to be like an ingrown hair or like a little pimple or things like that, okay? But that's not always the case. STDs or sexually transmitted diseases can present with what we call bumps or sores near your penis, vagina, or your anus, okay? The other one is warts, okay? We think about genital warts. Warts are, what do they look like? Well, they're warts, okay? Just like you'd have a wart somewhere else, you can actually have a wart down in your penis, vagina area, near your anal area, and sometimes they can be sort of in crops, meaning more than one, okay? That should prompt you to see your doctor to be tested, okay? But genital warts is one thing that we often see down there. I would also say, just in general, if you've got swelling in your vagina or your penis area, you got intense itching, that is absolutely a reason to see your doctor. And again, I don't know if I've said this yet, but let me say, the symptoms that I'm going to mention are often symptoms of sexually transmitted diseases, but they don't have to be. They can be symptoms of other things. So I know you may be watching this video to try to figure out what's going on with your body. It's why I need to say up front, you really need a doctor to help you know. You're not going to be able to tell necessarily on your own, although you may get a good idea, but sometimes things are funny. And sometimes what we're afraid about may not actually be, it could be something else, okay? And let me just go back. I've got a list of more symptoms we still need to go through, but the conditions that I'm referring to in terms of sexually transmitted diseases, and I should say STD or sexually transmitted disease, that is often referred to as STI or sexually transmitted infection, which tends to be the more accurate or sort of accurate way to say it. So you may see that when you're looking online, okay? But the conditions that I'm referring to are things like gonorrhea, chlamydia, genital herpes, genital warts. I just sort of talked about, genital warts, right? Things like hepatitis B, HIV, HPV, human papillomavirus, pubic lice. Now, this is an interesting one because pubic lice is not always considered a sexually transmitted disease. The reason why is that you can actually get it's most commonly spread through sexual contact, pubic lice is, but it doesn't have to be spread through sexual contact, okay? So keep that in mind, that it's not always considered an STD. Some organizations do consider it that, others do not, because it's not always sexually transmitted. Syphilis, trichomonas, vaginitis, okay? All right, let's keep going. Discharge from your penis. I mean, maybe I should have led with that one, but if you have a discharge from your penis, that is definitely concern for a sexually transmitted disease, okay? That is a concern that I have as a family doctor. You need to be tested ASAP, okay? Likewise, though, let's talk about the vagina, because vaginal discharge happens to the best of us, meaning all of us women, okay? That's a normal thing. Vaginal discharge in and of itself is not abnormal, because it's normal for female anatomy to have vaginal discharge. What I'm talking about is vaginal discharge that is different than your normal. It has an odor. It's a different texture. It's a different color, okay? Maybe it also comes with some irritation of your vagina. You're uncomfortable. Any change in your normal vaginal discharge, that is what I am talking about. And I do have some videos on vaginal discharge and what is normal and what is not. But yes, discharge from your penis, discharge from your vagina, that is not normal for you. Definitely need to be on the lookout for that. Vaginal bleeding for female anatomy, vaginal bleeding that happens when you're not on your period, you probably should have your attention, like your antenna up. It doesn't have to be an STD, right? But you got to just pay attention to these things and not blow them off. And let me also say that symptoms of STDs or STIs, they can go away on their own. okay? Some of them, depending on the condition, if you have an STD, depending on the condition you have, okay? Doesn't mean the STD went away. You have to get treated for STDs, and some STDs don't go away. We don't have a cure for them, okay? But just because your symptoms have resolved doesn't mean you are good to go. And the other thing I should say is if you have any of these symptoms, do not have sex with other people until you get this evaluated, okay? To make sure that it's not an STD, or if it is an STD, that you get properly treated. By the way, if it is an STD, don't have sex until your doctor says you can, okay? Don't put other people at risk. You need to also be upfront with other people too. I'll talk about that in a little bit. Painful sex sometimes can be a sign that you have a sexually transmitted disease, okay? Pain with sex. Also, pain with urination or frequent urination. I sometimes see this with men. Okay, like urinating is just a little weird. It just feels uncomfortable, okay? Also, I would say this is a big one, blisters or sores around your mouth. Don't forget that STDs, the symptoms and the signs are not necessarily confined to our penis and vagina and anus. The mouth, you can get oral gonorrhea, okay? There are other oral lesions that can pop up. So if you've got mouth lesions, you're like, ooh, get it checked out. And then the anus. I think that sometimes this is forgotten about, but anal itching, bleeding, soreness. I've mentioned anal lesions, anal warts, and things like that I've seen pretty frequently over the years. But, anal itching, lesions, all of that stuff really should be paid attention to. There are other symptoms, potential symptoms of STDs. And remember, not all STDs have symptoms. So if you're going through this list and you're like, okay, that's not me, I'm good. No, doesn't necessarily mean you're good, because there are many STDs where you may not have symptoms, or maybe you have symptoms for like a short period of time and they seem to go away and you were like, oh, I don't know, and you weren't thinking about it. Any of these symptoms need to be checked out, but let's take a step back though and remember things that are going to help us in the first place. Make sure that you're always using protection when you have sex, a barrier method, condoms, latex condoms, okay? Super important. Also, be discriminate about your sexual partners, okay? And I recommend you have a conversation about your past, your history, STDs and things like that. Look, if you're close enough to jump in the sack together, I'm hoping you're close enough to have these conversations to keep each other safe. Minimize the number of sexual partners that you have. It's not just a numbers game, but numbers play a role. The fewer partners, the less chance of STDs. Make sure that you are getting tested if you are sexually active, okay? And yeah, decrease the likelihood of risky behavior. We know that things like alcohol and drugs can decrease inhibitions, perhaps increase the risk of risky behaviors. The idea is you just want to keep yourself safe. As I said before, this video, and I have videos on syphilis, HPV, other syphilis, HPV, vaginal discharge, other videos. I will link them to this video. Remember, this is not the full list of symptoms with STDs, but if any of these are happening, anything is going on down there, okay, get a mirror and take a look so you know how to describe it. Take a picture, have your partner help you. Make sure you see your doctor, because the only surefire way to know if you have an STD actually is to get tested, okay? And remember, some STDs actually are silent. They don't have symptoms. Let me know if this is helpful. I'm Dr. Jen Caudle. Please, on Facebook, like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily videos. Please go to my website at drjencaudle.com to sign up for my free health newsletter. And then also, please follow me on Instagram and TikTok and other places at Dr. Jen Caudle. Guys, I'll see you soon.